The cardiac monitor in room 318 was shrieking when Sergeant Major Doyle Prescott hurled the bedpan across the room. It struck the wall beside the window with a hollow, metallic clang, leaving a dark smear against the pale yellow paint. The orderly who had brought in his morning medication, a young man named Terence, who had worked the ward for less than 3 months, stood frozen in the doorway, his face a careful, practiced blank that did nothing to hide the trembling in his hands. "I told the charge nurse," Prescott growled, his voice a rusted iron sound that filled every corner of the room. "I told her I wanted someone who actually knows what they're doing, not a boy, not a volunteer, not somebody who flinches when a man raises his voice." He was sitting up in bed despite the drainage tube running from the wound site on his left thigh, despite the IV line taped to the back of his right hand, despite the fact that his blood pressure reading on the wall monitor was flashing numbers that should have had 3 nurses in the room already. "Get me someone with a spine. Tell her that." Exactly those words. Terence left without saying anything. Smart kid. Down the hall at the nursing station of the Gary Veterans Care Unit at Winnipeg's HSC, the Health Sciences Center, Danny Okafor was already reaching for Prescott's chart before Terence had finished speaking. She was 31 years old, and she had a face that people consistently underestimated. Not pretty in any way that people paid attention to. Strong jaw, close-cropped natural hair growing back unevenly after she'd shaved it down the previous year, dark eyes that moved fast and recorded everything. She wore plain navy scrubs and white running shoes that had seen better days. No jewelry, no makeup. The other nurses called her the quiet one, though anyone who had worked a trauma bay with her knew better. She pulled the chart free and opened it, her eyes scanning the admission notes with the kind of methodical speed that came from years of reading in difficult conditions. Bad light, loud noise, adrenaline shaking your hands. She skimmed past the infection summary, past the surgical history, and slowed when she reached the service record. Sergeant Major, 2nd Battalion, Princess Patricia's Canadian Light Infantry, 3 tours, Kandahar, 2006, Panjwai, 2008, Helmand Province, 2010. Danny closed the chart. She did not react visibly. She picked up a pair of nitrile gloves and the prepared syringe tray Terence had abandoned on the counter and walked toward room 318. "You don't have to go in there," said Roberta Falk, the charge nurse, from behind her monitor. She was 53 years old and had worked this ward long enough to have strong opinions about which battles were worth fighting. "I can call the on-call physician and have him declared non-compliant. The dressing on that wound hasn't been changed in 18 hours, Danny. He won't let anyone near it. If the infection spreads, I'll change the dressing," Danny said. Roberta looked at her over the top of her reading glasses. "He threw a bedpan. I've had worse thrown at me." She said it, without inflection, in the same tone someone might use to note the weather. And Roberta, who had worked with all kinds, watched her walk away with the expression of a woman who had learned to leave certain questions unasked. Prescott's room smelled of antiseptic and old coffee, and something underneath both of those, the sharp copper note of infection that any experienced nurse could identify without looking at a wound. It was never a good smell. It meant the clock was already running. He didn't turn his head when the door opened. "I told the boy to send someone else," he said. His arms were folded across his chest, and he was staring at the window. The blinds were half drawn, throwing alternating bars of gray November light across the linoleum floor. Outside, Winnipeg was doing what Winnipeg did in November, producing a sky the color and texture of wet concrete. Whatever they sent, send it back. Good morning, Sergeant Major. Danny set the tray on the rolling table without asking permission and snapped on her gloves. My name is Okafor. I'm your nurse today. I need to change the dressing on your left thigh, and I need you to extend your arm so I can check the IV site. Prescott turned his head then. He looked at her the way a man looks at something he intends to refuse. A full, evaluating look that moved from her face to the tray, to her hands and back again. Okafor, he repeated. He had the kind of voice that had spent decades giving orders in loud environments. It had a natural carry to it, a resonance that was probably involuntary at this point. Where did they find you? The nursing station down the hall, Danny said, beginning to unwrap the supply kit. Don't be smart. I'm not. Your left arm, please. Prescott didn't move. He sat in the bed with his spine perfectly straight despite the IV, despite the drainage tube, despite the visible sweat at his temples that told her his fever had climbed again overnight. He had that particular military posture that became so deeply ingrained it, persisted through illness and surgery, and whatever else the body went through. An inability to let the spine curve even when every other signal said to rest. You know what I asked for? He said. I asked for a doctor, not a nurse, not an orderly, a doctor who has seen something, not a civilian who learned medicine from a textbook. The words came out flat and precise without obvious cruelty, which almost made them worse. This is not a general hospital. This is a veterans facility. The people in these beds have been places that your textbooks don't cover. I will not be managed by someone who does not understand that. Danny set down the gauze roll she was holding. She looked at him. You have a wound infection in your left thigh that has been worsening for 48 hours, she said. The culture that came back this morning shows Pseudomonas. That's a gram-negative bacterium. It is aggressive, and it does not respond well to delays in treatment. Dr. Marchetti has prescribed a targeted antibiotic regimen, and the first step is a proper wound debridement, which I am here to begin. She picked up the gauze roll again. You can make this difficult, and it will still happen. Or you can extend your arm, and we can get started. For a long moment, nothing moved in room 3 and 18 except the numbers on the cardiac monitor. Get someone else, Prescott said. It was quieter this time, not a command. Something closer to a plea wearing the clothes of a command, and Danny recognized the difference, though she gave no sign of it. I'll give you 20 minutes, she said, setting the tray aside. I'll be back at 10:15. She turned and walked out. In the hallway, she pressed her back briefly against the wall beside his door and closed her eyes for exactly 3 seconds. Then she walked to the nurse's station and began updating his chart. Roberta watched her from across the desk. Well? He needs minutes, Danny said, and did not elaborate. By 10 o'clock, Prescott's temperature had climbed to 38.9. Danny knew before she walked back into the room that it had. The monitor readings fed to the station, and she had been watching the number inch upward with the particular combination of clinical attention and controlled dread that came with watching a situation worsen in a controlled environment where the tools to stop it were available, but access was being refused. She knocked this time. A professional courtesy, not a concession. Still here, Prescott said. He hadn't moved much. The bars of gray light had shifted slightly across the floor. On the overbed table, someone, probably Terrence, before the incident, had left a paper cup of tea that had gone entirely cold. Your temperature is up, Danny said, moving to the supply cabinet. I'm not going to wait longer than this. The risk is past the point where waiting is reasonable. I didn't ask for your risk assessment. No. She began laying out the debridement supplies with the same systematic efficiency she'd have used in any environment, and it was that quality, the absolute absence of hesitation in her movements, the sense that her hands knew exactly where everything was and moved there without thought, that made Prescott go quiet for a moment. He watched her hands. "You've done this before," he said. It wasn't a question. "The dressing change?" "Yes, many times. That's not what I mean." Danny paused for half a second before continuing to lay out supplies. "I know what you mean. Then answer it." She didn't. She pulled on a second pair of gloves, sterile this time, and turned toward his bed with the supply tray. "I need you to straighten your leg and keep it still," she said. "This will hurt. Everything hurts," Prescott said, and it was the most unguarded thing he had said since she walked in. She worked in silence. He did not make a sound while she removed the old dressing, which was, as she had expected, worse than the external observation suggested. The wound margins red and hot, and showing the early liquefactive changes that meant the infection was active and moving. She cleaned it with methodical care, irrigated the wound bed, and began applying the new dressing with the kind of precision that required genuine concentration. Prescott watched her work on his own leg, and something shifted in his face that wasn't quite pain and wasn't quite recognition. "Where did you train?" he asked. "University of Manitoba, then a fellowship at the trauma center here." Before that, Danny applied a strip of medical tape with even pressure. "I did 3 years with the Canadian Forces Health Services before I transitioned to civilian nursing. I was a medical technician." Prescott said nothing. "Deployed twice," Danny added, though she hadn't planned to. "Afghanistan, 2009 and 2011. The room went very still. "What theater?" Prescott asked, and his voice had changed in a way that was difficult to describe. Not softer, exactly, but different in its texture, the way a command changes when it becomes a question someone actually needs answered. "Kandahar first," Danny said, "then Helmand. I was attached to a combat team out of Camp Bastion for the second rotation." Prescott turned his head to look at her fully. His eyes were pale gray, and the fever had given them a faint brightness that was unpleasant to look at directly. "Helmand," he said. 2011, yes. Which unit?" Danny smoothed the last piece of tape and pulled back. She stripped off the outer gloves and dropped them in the biohazard container. Then, without planning it, without knowing entirely why she was doing it. Perhaps because it was 10:40 in the morning and the infection was serious, and the man in the bed had been carrying something for a very long time, and she recognized the shape of it. She pushed up the left sleeve of her scrub top. On her forearm, just below the inside of the elbow, was a tattoo. It was not decorative. It had no softness to it, no flourishes, no color, no attempt at aesthetics. It was a caduceus, done in clean black lines, but the staff was wrapped not only by the serpents but by a maple leaf, and beneath it, in plain block lettering, were 3 words and a number. MedTech, 3 PPCLI. Prescott stared at the tattoo. When he looked up at her face, something had broken open behind his eyes. 3rd Battalion, he said. The words came out at half volume, like air leaving a wound. I was attached, not organic to the unit, but yes. Danny lowered her sleeve. For 7 months, Sergeant Major. I was in Panjwai with your boys in 2011, before the battalion rotated home. He said nothing. His jaw worked silently. You want to tell me I don't understand, Danny said. and her voice had lost all its clinical distance. It was still calm, but it was a different kind of calm now. The kind that comes not from detachment, but from having been somewhere and come back. You want to tell me I don't know what it means to be in that bed, and to be the one giving the orders, and to have given an order that went wrong. She sat down on the rolling stool beside his bed without being invited. I know what happened at the checkpoint on Route Foster's in October of 2011. I know because I was the one they called on the radio. Prescott's breathing changed. That was a long time ago, he said, and the words had no force behind them. Yes, 3 men. I know. I gave the order to hold the position. I gave it. The intelligence said the convoy was clear. I reviewed it myself, and I gave the order to hold. And then he stopped. The heart monitor registered a rhythm change, a small jagged spike, then steadied. Then the second vehicle. And then Corporal Thiessen was. He stopped again. His hands, resting on the blanket, had gone rigid. I have gone over that decision every day for 13 years. Every single day. I know every variable I had access to. I know every factor I weighed. And I still don't understand how I missed it. Danny was quiet for a long moment. You didn't miss it, she said. Prescott looked at her sharply. Don't. I'm not offering comfort, Danny said. I'm telling you something factual. The intelligence package you were working from had been flagged by ISTAR 2 hours before that action, and the flag was not passed to your level. I know that because I read the full after-action review. It was reclassified and released to a limited distribution 3 years ago, and I read it because I needed to. She held his gaze. The route assessment that came to you had a secondary movement notation stripped from it before transmission. There was a vehicle that had been on that road in the 90 minutes before your hold order that didn't appear in your traffic summary. It appeared in the full intelligence log, which you did not have access to. Prescott stared at her. That information existed, Danny said. It was not in your hands. The order you gave was based on the best available information at your level, which had been filtered before it reached you. He stopped. His voice had gone very rough. That can't, Sergeant Major Prescott. Danny leaned forward slightly. Her elbows rested on her knees. I have read that report twice. The section on Route Foster's takes up 12 pages. Your decision is reviewed across 6 of them. The conclusion is not ambiguous. He looked away from her. He looked at the window, where the November sky was doing nothing helpful, and his chest rose and fell with the slow, difficult rhythm of a man who has been holding something very heavy for a very long time and has just been told, for the first time, that he can put it down. Thiessen, he said, and MacPhail, and Trudeau, 3 good men I know. Danny's voice was quiet. I know their names. I knew their faces. I was there when the helicopter came in. Prescott turned back to look at her. His eyes were wet, and he did not try to hide it, which told her something about how far the fever and the exhaustion and the long unspoken grief had worn him down. You were there, he said. I was there. You were the medtech they called. Yes. He was silent for a long time. The monitor beeped its steady bureaucratic rhythm. Outside, something, wind or a vehicle, passed the window and moved on. I didn't know your name, Prescott said finally. I knew there was a medtech attached. I never knew your name. After, I tried to find out. I asked the liaison officer when we were back at KF. He said the medtech from that action had already rotated home. I left 2 weeks later. And you ended up here. I ended up here. Danny looked at him steadily. And you ended up here, and the infection in your thigh will kill you if you don't let us treat it properly, Sergeant Major. so I need you to let me do my job." Prescott looked at her for another long moment. Then, slowly, with the deliberate movement of a man choosing something rather than surrendering to it, he extended his right arm toward her. "Okafor," he said. "Yes. You should have told me who you were at the start. You weren't ready to hear it at the start." He almost smiled. It was not much of a smile, more a slight reduction in the severity of his expression, a microscopic thaw. But on a face like his, it was significant. "No," he said, "I suppose I wasn't." She connected the antibiotic line and set the drip rate with practiced efficiency. His fever, she knew, would break within the next several hours. The infection, caught before it had crossed into septic territory, would respond to the targeted protocol. His leg, all going well, would heal. He would walk out of this hospital, cautiously, probably with a cane for a while, but under his own power. The physical part, she understood, was the simpler part. The next 2 weeks on the Gary unit were not quiet, exactly. Veterans' wards were never quiet, and Prescott was not a quiet man. But room 318 became a different place. He followed every medical directive without argument. He was formally courteous to Terrence, who accepted the change with the cautious optimism of someone who had survived the first week of a very uncertain new job. He was direct and occasionally blunt with Dr. Marchetti, but in the way that indicated engagement rather than hostility. With Danny, he was something else. He was, she thought, honest in a way that had probably been unavailable to him for a long time. The particular honesty of someone who has been recognized accurately and no longer needs to manage how they are seen. They talked in the margins of her shifts, in the way that people talk when they share a geography that most people around them have never visited. He told her about the second tour in Kandahar. She told him about the field hospital at Bastion, the hours that blurred together, the learning curve of trauma medicine in a canvas structure in 40-degree heat. He told her about coming home to Thunder Bay and finding that his marriage had not survived the accumulated absences. She told him about the first winter back in Winnipeg, the strange, surreal quality of the LRT and grocery stores and civilian noise that meant nothing but was somehow too loud. "You never talked to anyone about it?" she asked him one morning, while checking his wound margins, dramatically improved, the redness receding, the tissue granulating cleanly. "I talked to the padre," he said. "Once. He was a good man. He said the right things. It didn't help PTSD programming. I was referred." He paused. "I didn't go." Danny applied fresh dressing without commenting on this, which was itself a kind of comment. "There's a group here," she said. "Thursday evenings. Run by a psychologist named Wentworth. She did 2 rotations as a civilian contractor with the forces, so she's not starting from nothing. It's not mandatory. I'm not suggesting it's mandatory, but you're suggesting it." "I've worked this ward for 4 years," Danny said. "The men who go to Wentworth's group are different 6 months later. That's all I can tell you." Prescott was quiet for a moment. "What about the ones who don't go?" Danny sealed the dressing and looked at him directly. "They come back," she said, "usually for something physical, and we start over." He was discharged on a Friday, which in Winnipeg in November meant a sky that had turned briefly, improbably blue, one of those prairie days that appeared without warning, and felt like an apology from the climate. The light through the lobby windows was almost warm. Danny was at the nursing station finishing her notes when Roberta appeared at her elbow. "There's someone in the lobby," Roberta said. "There are usually several someones in the lobby. Danny." Roberta's voice was unusual. "Come down." She came down. Prescott was standing, not in a wheelchair, having refused one with the particular stubbornness of a man who had walked into the building on his own 2 feet and intended to walk out the same way. The cane notwithstanding. He was wearing civilian clothes, dark trousers, a gray flannel shirt, a PPCI Veterans Association cap she hadn't seen before. He looked like what he was. A large, weathered man in his late 50s who had been through something difficult and had come out the other side of it somewhat more intact than he had expected. Beside him stood 4 people. She recognized one of them immediately, a woman named Tashiro, who had been in the unit in 2011 as a warrant officer and was now, apparently, a civilian. She still stood the same way. She would probably always stand the same way. The other 3 were men she did not recognize by name, but recognized entirely by bearing. Former soldiers in their 40s and 50s, the kind of men who had left the forces and carried the forces with them. One was missing 2 fingers on his right hand. One walked with a prosthetic ankle that was visible below his jeans. All of them had the alert, slightly contained quality of people accustomed to reading rooms and exits quickly. They were, she understood, the people Prescott had called. She stopped walking when she saw them. She was not sure what she had expected, but it was not this. Prescott moved toward her with the cane, carefully, without rushing, until he was a few feet away. He did not do anything performative. He did not make a speech. He was a man who had given enough speeches in his life and seemed to have arrived somewhere past them. "I made some calls," he said. "After you told me about the Root Foster's review, I have a contact at National Defense who got me a copy of the relevant section. You were right about the intelligence flag." He paused. "You were right about all of it." Danny didn't say anything. "I also made some calls about you," he said. "Your service record, your citation from Bastion in 2011. He looked at her with the pale gray eyes that had, 2 weeks ago, held nothing but fever and hostility and old anger. Now they held something considerably more complicated. "You were put in for a mention in dispatches, after the Rout Foster's action. The recommendation was filed and then lost in a unit transition. You were never notified." Danny went very still. "I've spent the past 10 days working on that," Prescott said. "I know people. The paperwork is moving again." He held her gaze. "It should have been done 13 years ago. It should have been done by me when I had the rank to make it happen. I didn't know your name. That's—" He stopped. "That is not an excuse. That is a fact that I intend to carry." Tashiro stepped forward. She was a compact woman with iron gray hair and the posture of someone who had never entirely left the army. And she extended her hand to Danny with the directness of someone who had probably been briefed on the situation and had no interest in sentimentality. "Warrant Officer Tashiro," she said, though they were both civilians now. 2011, Panjwi. "You don't know me, but I was on that radio too." Danny shook her hand. Then Prescott turned, not dramatically, not with ceremony, and said to the men behind him, "At attention." It was a quiet order, but it was still an order, and they responded to it the way men respond when something is real. 4 people straightened beside a man with a cane who straightened along with them, and 4 right hands rose in a single clean salute to a woman in navy blue scrubs with worn running shoes and an uneven haircut, standing in the lobby of a veterans hospital in Winnipeg in November. Danny stood still for a moment. The lobby had gone quiet in the way that lobbies go quiet when something unexpected happens. The ambient noise of the place pulling back as people nearby registered what they were seeing, without quite knowing what it was. Then she raised her hand. Some places are so far from the hospitals and lobbies and November light that it seems impossible the same person could exist in both. Danny Okafor knew that better than most. She had learned, over 13 years of civilian practice, that the distance between those two geographies was not measured in miles or years, but in whether you allowed yourself to be recognized across it. Today, she had been recognized. She held the salute until they did, and then she lowered her arm, and the lobby went back to being a lobby, and the day went on.